service being offered by Baptist Health System to help with a common problem affecting men as they age. And joining us now with everything you need to know is Dr. Ahmad Azawi. Welcome, welcome.
Thank you for having me.
All right, let's talk about it because we are talking about BPH. And for those who don't know, what is that?
BPH stands for benign prostate hypertrophy. What it is enlargement of the prostate. But with that comes a constellation of urinary symptoms that may come with that, and that can include going to the bathroom at night, frequency, urgency, slowed stream, straining, and can even progress to incontinence in some men.
And so how does it, I mean, you mentioned some of, what happens, right? The symptoms of this. That's really affecting quality of life, right?
For a lot of men it can. Some men may be completely without symptoms and have large prostates. Some men may have symptoms that affect their quality, decreased sleep, having to go frequently, planning their life around when they go to the bathroom next.
And so there is a therapy, right, that can be done. What can you tell us about it?
There have been several therapies that have been around for a while, but there's a newer therapy called aquablation that's been recently brought to the Baptist system as of fall of this year. What's unique about this is kind of when we look at these therapy options, some of these have a lot of side effects, and there's a question of, well, do I want something more durable, or do I want something that can impact some quality of life, things that are associated with the procedure, such as sexual side effects and things like that. Aquablation is unique in that it offers a balance of both, where you have the durability of the procedure as well as a minimal risk of side effects, especially some of the side effects we see with some of the other procedures.
And so what kind of results can a patient expect after this treatment?
So goals of this therapy are to improve these symptoms. So some of the improvements that we look for measuring how patients are doing after this procedure is increased stream, increased quality of life measures, and we have questionnaires that look at bathroom trips at night, bother, and quality of the urine. We look at the force of the stream, how much residuals are left in the bladder, and we see that it's very, very effective in doing in treating men in this condition.
Well, that's exciting to think that there are so many therapies up to this point, right, that also can help, but this really gets those results. Anything else folks should know?
With this procedure, what's unique about it is it's readily, it can treat a lot of different sizes of prostate. So, before, you may have been limited to some kinds of treatments compared to others just based on the size of your prostate. But for the most part, this compared to other procedures has been pretty almost universal, and most men are definitely going to be candidates for this treatment. So.
All right, doctor, thank you so much. For more information on Baptist Health System, just call 866-309-2873 or visit the website baptisthealthsystem.com/aqua.